بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. الطلبة الأعزاء، أرجو أن تكونوا جميعا بخير وصحة يا رب. اليوم حنكمل وياكم محاضرات مادة الفارماكولوجي 1، وحنكمل وياكم المحاضرة الخامسة واللي يكون عنوانها الأدرينرجيك أجونست. يعني مثل ما تعرفون المحاضرتين السابقة كملنا الكولينرجيك دراكس اللي هي include cholinergic agonist and cholinergic antagonist. So for today I'm going to talk about the adrenergic agonist. Okay, so at the beginning I just want to highlight some point or give you some background information about the topic. So adrenergic drugs affect receptors that are stimulated by norepinephrine or the noradrenaline, or epinephrine, which is the adrenaline. And these receptors are known as adrenergic receptors or adrenoceptors. اوكي، يعني مثل ما تكلمنا بالمحاضرات السابقة عن الكولينرجيك ريسبتورز اللي هي قلنا include المسكارينيك and nicotinic receptors. So for the adrenergic system include the drug which are affected the adrenergic system. These drugs affect the receptors that are stimulated by norepinephrine or epinephrine, and these receptors are called or known as adrenergic receptors or adrenoceptors. These drugs activate the adrenergic receptors are termed to sympathomimetic. هذه اللي تعمل activation للadrenergic receptors. However, the drugs that block the activation of adrenergic receptors are termed sympatholytics. Okay? إذن الدراكس اللي تعمل activation للadrenergic receptors called as sympathomimetic drugs. However, the drugs that block the activation of adrenergic receptors known as sympatholytics. And some sympathomimetics directly activated adrenergic receptor. So these drugs or agents called as direct acting agonists, while others act indirectly by enhancing release or blocking the reuptake of norepinephrine, and these are known as indirect acting agonists. مثل ما تشوفون بالفيجر اللي واضح أمامكم اللي يوضح السايت of action of adrenergic agonists. So and you know that adrenergic neurons release norepinephrine as the primary neurotransmitters, and these neurons are found in the CNS and in the sympathetic nervous system. تذكرون المخطط السابق اللي أخذناه، واللي هذا هو البارت من عنده اللي يوضح إفراز النورابينفرين اللي هو يكون related بالsympathetic nervous system, where they serve as link between ganglia and the effector organ. Adrenergic drugs act on adrenergic receptors located either presynaptically on the neuron or both synaptically on the effector organ. Okay, so this figure shows the synthesis and release of norepinephrine from the adrenergic neuron, and as you know that the neurotransmission at adrenergic neuron in adrenergic neuron closely resemble that described for the cholinergic neurons. يعني هسه هذه الميكانيزم اللي تشمل النيوروترانسميشن والميكانيزم تكون similar للميكانيزم اللي I have described before for the cholinergic neurons, except that the norepinephrine is the neurotransmitter in state of acetylcholine. احنا نعرف انه بالcholinergic receptor النيوروترانسميترز اللي involved هو الacetylcholine, while in the adrenergic neuron النيوروترانسميتر هو النورابينفرين. neurotransmission involve the following steps مثل ما تشوفون بالفيجر الواضح أمامكم اللي هي synthesis, storage, release and receptor binding of norepinephrine followed by removal of the neurotransmitter from the synaptic gap. يعني هذه just for remind you about the mechanism of synthesis and release of norepinephrine from the adrenergic neuron. وإذا تذكرون الفقر السابق اللي أخذناه اللي هو related بالcholinergic system راح تكون أنه العملية مشابهة ما عدا أنه النيوروترانسميترز اللي يحصل له ريليز هو النورابينفرين instead of acetylcholine اللي هو كان released in the cholinergic neurons. Adrenergic receptors. So in the sympathetic nervous system, several classes of adrenoceptors can be distinguished pharmacologically. So two main families of receptors designed as alpha and beta are classified based on response to the adrenergic agonist epinephrine, norepinephrine and isoproterenol. Okay, يعني هذه هنالك العديد من الريسبتورز اللي هي تكون related المين two families اللي هي الألفا and بيتا واللي هي يحصل لها classification as response to the adrenergic agonists. Both alpha and beta receptor have a number of specific receptor subtype. يعني شلون احنا بالمحاضرات السابقة تكلمنا انه المسكارينيك يعني يوجد منه مسكارينيك 1 2 3 4 5 وهنا بهذه الحالة أيضا موجود العديد من السبتايبس اللي هي تكون related بالألفا and beta receptor. So for alpha adrenoceptors, the alpha adrenoceptors show a weak response to the synthetic agonist اللي هو isoproterenol, but they are responsive to the naturally occurring catecholamines اللي هو الابنفرين and norepinephrine مثل ما تشوفون بالمخطط اللي واضح أمامكم إنه show low affinity للسynthetic product بينما تكون high affinity للnorepinephrine and epinephrine. وأيضا الأدرينوسبترز alpha adrenoceptors are divided into main subtypes اللي هم الألفا 1 and ألفا 2 وهذا based on their affinity for the alpha agonist and antagonist وبعدها further divided into subgroups اللي هي ألفا 1A ألفا 1B ألفا 1C and so on. This extended classification يكون necessary for understanding the selectivity of some drugs. أوكي هذه بالنسبة للألفا أدرينوسبترز مثل ما تلاحظون أمامكم أنها تنقسم ألفا 1 and ألفا 2 وبعدها هذه بالاعتماد على الافينيتي for alpha agonist and antagonist وبعدها أيضا تقسم إلى sub groups وهذه extended classification هو necessary for understanding the selectivity of some drugs. بالنسبة بيتا adrenoceptors so إنه تكون characterized by strong response to isoproterenol with less sensitivity to the epinephrine and norepinephrine مثل ما قبل شوية بالفيجر هذا نفسه إذا نرجع عليه يوضح أن البيتا أدرينوسبترز تكون لدي low affinity للنورابينفرين والإبنفرين بينما high affinity للسynthetic agonist اللي هو الأيزوبروتيرينول. The beta adrenoceptors also can be subdivided into three major subgroups اللي هي البيتا 1, beta 2 and beta 3 وهذا بالاعتماد على their affinities for adrenergic agonist and antagonist as well. So this figure shows the major effects mediated by alpha and beta adrenoceptors ويعني هذا حتى أنه يحتاج you need to read and understand the information which are presented in this figure so which reflects the major effect mediated by alpha or and beta adrenoceptors. يعني مثل ما تشوفون مثلا for alpha 1 إنه ال effects mediated إنه يعمل vasoconstriction, increase peripheral resistance, increase blood pressure, mydriasis, and increase closure of the internal sphincter of the bladder, and so on. So you need to read and understand the information which are related in this figure, because they will help you to understand the effects of each receptor and how the drugs will affect on these receptors. The characterization of adrenergic agonists. So most adrenergic drugs are derivative of beta phenylethylamine, واللي راح يحصل substitution on the benzene ring or in the ethylamine side chain, produce a variety of compound. هذه الكompound varying in abilities to differentiate between alpha and beta receptors and to penetrate the CNS. اوكي، يعني هذه نتيجة انه يحصل substitution اما للبنزين رينج او للأثيلامين سايد تشين. هذه راح تؤدي الى تكوين variety of product. هذه تكون varying بالability to differentiate between alpha and beta receptors and to penetrate the CNS. Two important structural features of these drugs are the number and location of OH substitution on the benzene ring, and second, the nature of the substituent on the amino nitrogen. Okay, so catecholamines, sympathomimetic amines that contain the 3,4-dihydroxybenzene group, واللي such as epinephrine, norepinephrine, isoproterenol and dopamine. هذه تسمى بالcatecholamines. These compounds share the following properties. Number one, high potency. So they show the highest potency in directly activating alpha or beta receptors. يعني هذه الcatecholamines هي كلها share these properties. First one is the high potency, so they show a high potency in direct activation alpha or beta receptor. Number two, rapid in activation, so they are metabolized by the COMT, which is catechol or methyltransferase, both synaptically, and by the MAO, which is the monoamine oxidase, interneuronally by COMT and MAO in the gut wall and by the MAO in the liver. هذه يعني how the metabolized and which enzymes are responsible for the metabolism according to different organs. They have only a brief period of action when given parenterally, and they are inactivated when administered orally. Okay, number three, they are polar. So according to the penetration into the CNS, so they have poor penetration into the CNS, so they are polar and therefore do not readily penetrate into the CNS. وهذه كلها share these similar effects, and some تكون nevertheless most catecholamines have some clinical effects including anxiety, tremor and headaches, that are attributable to the action on the CNS. Another agents which are the non-catecholamines, واللي هي عبارة عن compounds lacking the catechol hydroxyl groups, واللي تكون have longer half-lives because they are not inactivated by the COMT. اوكي. هذه تكون non-catechol-amines. هذه الاجنتس تكون lack the catechol hydroxyl groups. والبروبرتيز هذه الاجنتس تكون have longer half lives لأنهم they are not inactivated by the COMT. وإكزامبل على هذه الاجنتس اللي هي الفينلفرين، الإفيدرين and الأمفيتامين. These agents are poor substrate for MAO as well, which is an important route of metabolism, and thus show a prolonged duration of action. Okay. Increased lipid solubility of many of non-catechol-amines due to lack of polar hydroxyl groups permits greater access to the CNS. اوكي. بما انه هي تكون increased lipid solubility فراح تكون better or permit greater access to the CNS. Substitution on the amine nitrogen. The nature of the substituent on the amine nitrogen is important in determining beta selectivity of the adrenergic agonists. يعني هذه تكونها important rule in determining beta selectivity of the adrenergic agonists. Mechanism of action of adrenergic agonists. So as you can see in this figure, some have direct acting agonists, some classified as indirect acting agonists, and some has mixed action agonists. So for the direct acting agonists, these drugs act directly on alpha or beta receptors and producing effects similar to those that occur following stimulation of the sympathetic nerve or release of epinephrine from the adrenal medulla. هذه بما أنه تكون direct acting agonist, so أنه تكون act directly on alpha or beta receptors و produce effect. هذا الeffect يكون similar للeffect following by the stimulation of the sympathetic nerves or release the epinephrine from the adrenal medulla. وتكلمنا احنا او ذكرنا example على ال direct acting agonist اللي هي الابنفرين, norepinephrine and so on as you can see in the slide. Second, the indirect acting agonists. So these agents may block the reuptake of norepinephrine or cause the release of norepinephrine from the cytoplasmic pools or vesicles of the adrenergic neuron. اوكي. انه هذه ايضا هي تكون agonist لكن الاكشن يكون indirect. بما انه indirect فيحصل as a result of block the reuptake of norepinephrine or by causing the release of norepinephrine from the cytoplasmic pools or vesicles of the adrenergic neurons. المثال عليها اللي هي example مثلا of reuptake inhibitors and agents that cause norepinephrine release include cocaine and amphetamine اللي هي تعتبر examples على agents اللي related to this group. Number 3 mixed action agonists اللي هي الإفيدرين and its stereoisomer اللي هو pseudoephedrine. So these both stimulate adrenoceptors directly and enhance the release of norepinephrine from the adrenergic neuron. وراح نجي يعني نتكلم على agents هذه compounds اللي هي تكون related for each group. Okay, so for the direct acting adrenergic agonists احنا تكلمنا عنها هذه agents وقلنا انه هي bind to adrenergic receptors on effector organs without interacting with the presynaptic neurons. الإكزامبل عليها first اللي راح نتكلم عليه اللي هو الإبنفرين. والإبنفرين is one of the 4 catecholamines اللي قبل شوية ذكرناهم، اللي هي الإبنفرين، نور إبنفرين، الدوبامين and الدوبيوتامين. وهذه الagents تكون on stimulation the adrenal medulla release about 80% epinephrine and 20% of norepinephrine directly into the circulation. والإبنفرين interacts with both alpha and beta receptors at low doses, so the beta affects vasodilation on the vascular system predominant, whereas at high عادي بالlow dose إنه تكون beta effects has beta effects of vasodilation on the vascular system predominant, whereas at high doses alpha effects اللي يعمل vasoconstriction are the strongest. Okay. الأكشن للإبنفرين, so it has cardiovascular action. The major action of epinephrine are the cardiovascular system, so it strengthens the contractility of the myocardium اللي هي البوزيتيف inotrope beta 1 action, and increase its rate of contraction اللي هو البوزيتيف chronotrope beta 1 action. Therefore cardiac output increase, يعني بكمحصلة راح يؤدي إلى increased cardiac output. و these effects also increase the oxygen demands on the myocardium. والإبنفرين activates the beta 1 receptors on the kidney to cause renin release. ومثل ما تعرفون إنه الرنين is an enzyme involved in the production of angiotensin II, which is a potent vasoconstrictor. والإبنفرين also constricts arterioles in the skin, mucous membrane and viscera by alpha effect, and it dilates vessels going to the liver and skeletal muscle by beta 2 effects. The combined effect result in decrease in renal blood flow. Therefore the cumulative effect is an increased systolic blood pressure and coupled with a slight decrease in diastolic pressure due to beta 2 receptor mediated vasodilation in the skeletal muscle vascular bed. Okay, so هذا الأكشن للإبنفرين on the cardiovascular system, واللي هي مثل ما ذكرنا أنه تؤدي إلى increase cardiac output, تؤدي إلى increase oxygen demand on the myocardium, تؤدي إلى activate beta 1 receptor on the kidney, would cause renin release and other effects as you can see in the slide. Okay, another action which is the respiratory. In this case, epinephrine causes powerful bronchodilation by acting directly on bronchial smooth muscle, which is beta 2 action, and also it inhibits the release of allergy mediators such as histamine from the mast cell. So for the respiratory system has this important function, which is bronchodilation, and this effect occurs by acting directly on the bronchial smooth muscle and inhibit the release of allergy mediators such as histamine from the mast cell. It also has hyperglycemia, this action as well. So epinephrine has a significant hyperglycemic effect, and the reason for that because of increased glycogenolysis in the liver, واللي هي تكون beta 2 effects, and increase the release of glucagon اللي هي as well beta 2 effects, and decrease the release of insulin اللي تكون alpha 2 effects. Lipolysis, so it initiates the lipolysis through agonist activity on the beta receptors of adipose tissue. Okay, so the therapeutic uses, it used as in case of bronchospasm. So epinephrine is the primary drug used in the emergency treatment of respiratory condition when bronchoconstriction has resulted in diminished respiratory function. اوكي احنا قبل شوية اتكلمنا عن الeffect on the respiratory system، لذلك انه يستخدم احد الثيرابيوتيك or important therapeutic uses للابنفرين in case of bronchospasm. So it's used in the emergency treatment of respiratory condition اللي يكون بيها bronchoconstriction has resulted in diminished respiratory function. لذلك هو يكون treatment of anaphylactic shock، والابنفرين is the drug of choice and can be life-saving in this setting. Second, it's used for anaphylactic shock, والابنفرين is the drug of choice in this case for the treatment of type 1 hypersensitivity reaction including anaphylaxis in response to allergens. It's used in cardiac arrest. So it may be used to restore cardiac rhythm in patient with cardiac arrest. احنا قبل شوية ذكرنا انه has a cardiovascular effect or action, and one of the therapeutic uses as in case of local anesthesia. So in this case local anesthetic solution may contain low concentration of epinephrine. والimportance this يعني why they include low concentration of epinephrine, so because it greatly increases the duration of local anesthesia by producing vasoconstriction at the site of injection. يعني لذلك يتم وضع تراكيز قليلة من الابنفرين ويا اللوكال anesthetics لأنه يساعد على increase the duration of local anesthesia by producing vasoconstriction at the site of injection, and it also reduces systemic absorption of the local anesthetics and promotes local hemostasis. It's used in case of intraocular surgery, so it is used in the induction and maintenance of mydriasis during intraocular surgery. هذه الثيرابيوتيك or different therapeutic uses للابنفرين in terms of pharmacokinetics. So epinephrine has a rapid onset but a brief duration of action، وهذا يحصل نتيجة rapid degradation. The preferred route of administration in case of anaphylaxis is intramuscular لأنه يحصل rapid absorption due to rapid absorption. وin emergencies epinephrine is given intravenously or for the most rapid onset of action. احنا نعرف انه طريقة الاعطاء مثل ما اخذنا سابقا انه الاي في يعني used in case of emergencies لانه راح تؤدي الى rapid or most rapid onset of action. It may also be given subcutaneously by endotracheal tube or by inhalation. يعني هذه different way of administration as well can be used. It is rapidly metabolized by the MAO and COMT. والميتابولايت excreted in urine. Adverse effects include anxiety, fear, tension, headache, and tremor. It can trigger cardiac arrhythmias خصوصا بالpatient receiving digoxin. It induces pulmonary edema. In patients with hyperthyroidism may have an increased production of adrenergic receptor in the vasculature. واللي يؤدي إلى leading to an enhanced response to epinephrine. And the dose must be reduced in these individuals. Inhalation anesthetics also sensitize the heart to the effect of epinephrine, and this may lead to tachycardia. Epinephrine also increases the release of endogenous store of glucose. لذلك بالبيشنت اللي يعانون من الدايبيتيز dosage of insulin may have to be increased. و non-selective beta blockers prevent vasodilatory effect of epinephrine on beta-2 receptors, and this leaving alpha receptor stimulation unopposed. In this situation, this may lead to increased peripheral resistance and increased blood pressure. So these are the main side or adverse effects which are related to the administration of epinephrine. Okay, so now you will have rest for 10 to 15 minutes, and after that I will complete the topic.